Hello, everybody. How is everybody? What's up, James? I sent you a message, James. Happy Monday. Today's Monday. I hope everybody is off to a great start. So if this is your first time here in the channel, welcome. So my name is actually Dr. Jones, and man, there's so much cool stuff to talk to you guys about. I don't even know where to begin. I guess we can start with just a little bit about what we're doing and where we're coming from. I have clinics, right? We service across the nation. And specifically, we help our patients achieve lasting weight loss goals, specifically helping them to navigate around GLP-1 medications like semaglutide, tirzepatide. And I think what's different and just unlike any other platform I've seen or other people talking about these medications is how do we use them where the focus is the end goal, right? Where the focus is the future. I am putting out so much content right now on my various platforms, getting into the long form content too as well, so I can really time because when we talk about this stuff on TikTok in these short format videos, it's really hard to get into the weeds of it and really dive into the nuances of it. But I do my best. But in this process of going deep, I've really been able to get into just so much more of like the bigger picture and how it works. We're definitely going to get into all of that, guys. So why don't we start by just introducing yourself? Let me know where you guys are at, where you're watching from. Are you taking semaglutide? Are you taking tirzepatide? Any of these GLP-1 medications? And let me know how it's going. Are you successfully losing weight? And what does that look like for you? We'll get into all that and get all your questions answered. Kodiak Bear, welcome. So Kodiak, I'm 19, female, 5'5", 230, and let's see. I've been trying to lose weight naturally, but can't. Am I eligible for Wegovy? Well, first of all, Kodiak, I can't give you any sort of specific medical advice, but from a general perspective, GLP-1 medications are there for people suffering with real disease, with real issue. The driving factor behind this would be obesity, right? Insulin resistance, weight loss maintenance resistance, inflammatory issues. So if you have tried again and haven't had any success, then potentially we can say that maybe these medications would be a good option for you. You just can't get into that from a general perspective at all, especially without any history. But hopefully that answers your question from a general perspective. Kodiak Bear, BMI 38. Okay, well, if you're BMI 38, then yes, that is the medical sort of criteria, if you will, for these medications. So absolutely, this might be the best path for you. Again, these medications are really need to be considered if you've tried and there's this barrier. You can't shut down the food chatter. You can't get past it. Then these medications might be the best option for you. Should I be concerned about a $50 size rash at injection site? I would definitely switch your injection site I wouldn't be concerned unless the rash is growing, getting worse in severity. Uh, those would be sort of my criteria for potential concern. Kodiak Bear, does semaglutide have to be a permanent medication? You know, welcome to the club, Kodiak. Uh, this is where everybody is going to have different opinions. I can tell you that if you hang out, you become a warrior, you follow my guidance, my structure, my goal for you is going to be so that you're not like everybody else, so that we defy the literature and that we get you off these medications long term. That is my goal for everybody who works with us. And I think for most people, this is a possibility, not for everybody, but for most people. And it's going to take work, but it's going to take work that's centered around addressing those underlying issues that drive obesity. Hello, Blair. Hey, Carol. So Carol's on Tirzepatide, and yesterday had lots of gut pain. I believe it's a med because I did have the same issue with semaglutide when I took that before. Do you have any advice for helping with that pain? I tried my normal red light therapy and did not do much. Carol, so pain from GLP-1 medications is obviously sounds like it's happening from most medications. It's quite possible that GLP-1 might not be the right solution for you. The good news is, though, Carol, we have other options. We have other powerful weight loss medications. And truthfully, with us, it's all about the end game. It's all about the long term where we want to help you wean off medications, right? So we're going to just use anything we can to help suppress that appetite, help shut down that food chatter, and help you implement the lifestyle choices that are going to be necessary long term. Let me know if that makes sense, Carol. And I see a lot of you just hopping into the channel. Welcome, welcome. I've already introduced myself. We're talking about lasting weight loss. We are talking about various components and programs that are addressed towards helping people achieve long-term weight loss. Do me a favor, introduce yourself. Let me know where you're at. Let me know what's going on with you, Carol. I see that. I'll get to your question here. Let me just finish this intro. And do me a favor, smash this like button, share this live with anybody that you think would benefit from this sort of content. As you know, we put out a ton of content related to lasting weight loss. And we're here to service you guys to the best of our ability. If you want to participate in our contest, if you want to increase your chances of winning free peptides, be sure to follow the channel and turn on your notifications for every single time we go live, that you get notified and you increase your chances of winning. Carol, so you're definitely going to want to go see your primary care if you're getting pain every single time. I mean, this is definitely something that doesn't sound good. Pain is not supposed to be a typical side effect of GLP medications are nausea, diarrhea, vomiting, things of that nature, indigestion, but not pain. So I would definitely go see your primary care. Let them know what you're on. Let them do a physical examination and see what can possibly be done. KG. So we sent a message out to everybody that the AOD should be shipping. Do me a favor, KG. Shoot me a direct message on this page, or better yet, in case I missed that, just shoot a message over to the full hotline or the medical line, and we will respond and get an updated ETA for you. But from what I was told, I think the AOD is going to be shipping today or tomorrow. Hey, Kay Sirico from New York City, struggling to lose weight. Never had trouble till I turned 50 and also menopause. So, Sirico, thank you for sharing that. And menopausal induced weight loss in the and trust me when I say this, we help them every single day. And so I'm all too familiar with how difficult it is to navigate around this. It's definitely an issue. And what I can say is it's almost like it's kind of a snap, like overnight thing, right? Anybody watching this, if you have menopause, let me know if this is something you can relate to. But you spend most of your life, your adult life, knowing more or less what you need to do and what you can't do to be successful. And then all of a sudden, it's like, bam, menopause hits. Now nothing's changed, and you don't seem to have that same control. You aren't able to just control things and get your weight loss rolling. And so this is due to an increase in insulin resistance. And a lot of it is induced by menopause. But the good news is that's what we focus on. That's what the flow protocol, thank you, Blair, for sharing that. That's what the flow protocol is all about. That's what we emphasize on, is driving in these core principles that help a person become more insulin sensitive, reduce inflammation levels, and become more fat adapted. So we can absolutely help you with that issue, with menopause, and we have a ton of success. So a couple of people are asking a bunch of questions. Guys, if you have any questions at all about the resources, about what we can do to help, how the program works, if you're curious, go to the website that you guys see above my head, right at the very top. It says weanoffmeds.com. So if you go to weanoffmeds.com, you can fill out the form and get scheduled for a consultation. Carol, let me know if that's better. I'm pretty sure that's better now. Let me know how that sounds, Carol. GL Grimm, I'm in perimenopause as well in Florida. It's so frustrating. GL Grimm, we got you covered. The flow protocol is the answer. And I'm happy to get into that and answer any more questions regarding it, but we have a solution. So just get yourself scheduled, get this fixed. Let's get quality of life. There was a question I saw. I'm scrolling back. Why don't I answer something about something? Where'd that question go? Are you able to help with 0.075 Synthroid? So yes, we have medical staff. I work with medical practitioners, and my medical team can help with thyroid management and hormone optimization. So we can absolutely have you covered there and can get you taken care of. CSAM, welcome from Toronto. Oh, you're from Toronto, Steve. Or not Toronto, Tortola. All right. I have no idea where that's at. That sounds cool. Sherry ID. Sometimes I feel like the unhealthiest person. Oh no, we got you covered. We know what to do and what changes to make to get you in the right direction. That's for sure. What is the best graph for an ACL tear? I couldn't tell you what the best sort of graft is. I mean, your choices are your own tissue or a cadaver's. I personally had a cadaver's ACL. My there's a lot of pros and cons to both. Truthfully, it's a decision that needs to be made by your individual surgeon. Hopefully, they don't just do all one type, because there are certain situations for certain people where one type of graft might be a better choice than another type of graft. So definitely, hopefully, you're working with a surgeon that can do an individual evaluation. Now, as far as peptides, then Dog, I'm going to get to your question next. So as far as peptides, BPC 157, TB 500, that is the go-to powerhouse of musculoskeletal healing peptides. Dr. Huberman just did a podcast where he went into the weeds of peptides, and I'm putting out a freaking hour-long practical guide to peptides. So my video is going to be more about here's what you need to know to get started. His is more about let me just learn more about the science of peptides as well, which is nice. Mine's more practical. Mine's going to be the most comprehensive practical guide to peptide therapy you're going to find, period. All right, Doug, let me get to your question. Um, well, what's the question now? Doug, you got my attention. What's your question? And I will get an answer. Um, yeah, I'm not sure. I apologize, Dog, if I missed your question. Was that the question that I earlier was like, what was that question? Something about my compounding pharmacies? Is that what they were asking? Where do I get them from? Is that I'm not sure. Uh, Dog, if you're asking, we work with pharmacies, and my medical practitioner writes prescriptions, and then we ship the peptides to your door. I'm not sure exactly. Yeah, I don't think that was the question. My bad. Um, how do you wean off? I lost 25 pounds in 5 months on Zepbound. That's great. That's super stoked that you lost that much weight. So let's get into it. Um, so there's a lot of pieces towards weaning off. In fact, I just released a 45-minute video talking about how we do that. But essentially, we have to take a step back and look at the big picture, guys. So maintaining weight loss, even without medications, is already extremely challenging. You guys might not realize this, but based off the literature, 80% of people, so check this out, document this, document this in your brain right now, Dog, and everybody else. 80% of people, all measures of weight loss, will gain back all their weight within a couple years. So if you know somebody who has successfully maintained weight loss beyond a couple years, that is what we call a unicorn, my friends. You're going to want to tag it, bag it. No, you guys ever saw that dude about unicorn? But seriously, though, they really are, because maintaining weight loss has been a mystery. And so now we talk about these powerful medications, which are making it significantly easier for people to lose weight on the front end. But if the problem has always been maintaining weight loss, we didn't solve that problem with these medications. In fact, logic tells us that we made the problem worse. And the data also backs that up. Semaglutide step trials, randomized control studies, within a single year of stopping semaglutide, patients regained all their weight back. 70% of them within 1 year. Okay. Again, common sense tells us that if we already knew that maintaining weight loss as a whole was challenging, and now we lost weight with a powerful medication. I don't care whether it's GLP-1s, whether it's phentermine, Contrave, it doesn't matter. Right? So now, how do you successfully maintain weight loss, regardless of what your method is? You have to beat whatever it is that's driving that weight loss resistance, right? Obesity, insulin resistance, inflammation, all these various factors that we can identify in people who struggle with weight loss maintenance, right? I call it weight loss maintenance, right? And then weight loss maintenance resistance. This is a classic symptom that you see in obese, insulin-resistant patients, PCOS, menopause, inflammatory conditions. Their body is resistant to maintaining the weight loss. Right? And so if you use the medication, you stop the medication, you still have the disease, you still have the driving factors, right? But if you can implement powerful lifestyle intervention that addresses those underlying factors that drive that obesity, right? We just talked about some big key ones: insulin resistance, inflammation, and metabolic flexibility. Those are the big ones. Okay. And so what we do, the way that we help patients is via the flow protocol. The flow protocol is how we get this done. It is a powerful coaching program, and we use science-backed peptides, medications, and various aids to support, right, And we help our patients implement that with the coaching, with the guidance, with the support, with the structure, and with the help of peptides and other powerful anti-aging therapies. So, Doug, that was my best way to like summarize it. Let me know if that answers your question and if you have any other um, questions. Look, Gertie, incorrect. Look, says taking diabetic medication doesn't cure it. You stay on the meds. It's actually that's not true. Look, you can go to the American Diabetes Association website, and they literally released the criteria for diabetes reversal. So diabetes is a beatable disease. Obesity is a beatable disease. The medications don't fix it. You're right. I never said that. The medications are the first step towards implementing the actual solution, which you still have to choose to do. The solution to beat it is fixing your lifestyle, making better choices that don't drive the disease process. Then you can get to a point where you may be able to wean off the meds and maintain health. So, look, I think the best way to kind of respond to what you're saying. So, um, low GLP in your gut is certainly one of many theories as to what causes the need for GLP-1 medications. We didn't have obesity anywhere near the staggering rates that we do now 50 or 100 years ago. Human beings did not evolve to have lower GLP. Okay. So there's a lot more going on. And from an evolutionary perspective, it doesn't make sense to have a theory behind such a rapid shift in the amount of in just the rates of obesity as a whole, right? So again, we bring it back to physiology. We bring it back to insulin resistance, inflammation, and metabolic flexibility. When you improve those three things, you are literally treating the disease itself, which is driving these issues, which is driving the food chatter, which is driving the hunger, which is driving the cravings. You have to implement it. And user 17, we can absolutely talk about solutions to insulin resistance. I think it's a great topic. Why don't you guys let me know, what do you want to see me train on next? Do you want to see me train on insulin resistance? Would you rather see me train on metabolic flexibility or weight loss plateaus? Let me know. In the meantime, guys, I see a lot of people hopping into the channel. So welcome, welcome. My name is Dr. Jones, and I am a holistic obesity expert. So what I do is I help my patients achieve lasting weight loss. Can I get a sound check? Some people are telling me that the sound, it's really difficult to hear me. One person on Facebook said that. Let me know for the rest of you guys on TikTok, is my sound going good? And then for you guys listening to me on StreamYard and all my other platforms, okay, thank you. So TikTok is great. How about you guys watching me over there on StreamYard? Let me know if the sound quality is still crummy or what's going on. But not everybody here on TikTok is hearing me. So, okay, good. So I own clinics. We service across the nation, and we help our patients achieve lasting weight loss. And look, I've been doing this for 20 years, both before I became a doctor, before all of that, just from managing gyms, managing hundreds of personal trainers and thousands of clients across the gym. So I've seen it all as far as the trend between calories, now hormones. I actually put out this really cool video a couple days ago where I talk about the calories versus the hormones and the basis of obesity. So you're definitely going to want to check that out. But ultimately, if you are on GLP-1 medications like semaglutide or tirzepatide, if you're thinking about taking these medications, if you are taking them, in my opinion, and you guys tell me what you think, why wouldn't you be thinking about the future? Why wouldn't you be thinking about, okay, great, I'm going to start these medications. They're going to shut off my food chatter. I'm going to feel better. I'm going to be able to make better choices. I'm going to get my weight started. Hoorah, hoorah, right? Like exciting exciting, right? But what's going to happen after that, right? Why would we not put some attention on that? We have to look at the data that exists out there when it comes to weight loss. Maintaining weight loss is the problem. Losing the weight itself is not the problem, ladies and gentlemen. The problem is being able to maintain that weight loss for the rest of your life. So that's what I want to help you guys unravel. That's what we specialize in. We have a 94% success rate doing that, navigating around these medications. So if you just hop into the channel, welcome. This is what we are talking about. So do me a favor, introduce yourself. Let me know if you're excited to learn about the secrets of lasting weight loss, how that is possible. Yes, I am pro GLP-1 medication, but I am pro the intelligent use of GLP-1 medications. What do I mean by intelligent use? I mean using it as a tool and not the solution. So let me know what your name is, where you're watching from. Are you taking semaglutide? Are you taking tirzepatide? What does the big picture look like for you? What's the game plan? What's the goal? And we're going to get into all of this. So while you guys are doing that, while you guys are letting me know where you're coming from, do me a favor, smash that like button and share this live with anybody that you know would benefit from lasting weight loss. We put out so much content out there, and I mean it when I say I'm on a mission statement to help a million people battle obesity. So real quick, and I'm going to get back to my intro because I got a couple people asking for my qualifications. And so, guys, I'm a doctor of chiropractic. I own medical clinics, so I don't have to write prescriptions. My medical practitioners write them. It's an awesome collaboration. So my medical practitioners write the prescriptions. I get to focus on the coaching. So, I mean, would you really want a one-person show doing everything for you, or would you rather have a team of clinicians working together for your benefit? And ask me, 2 and 3 better than 1. So, my passion, my focus is the coaching and the structure, and then my medical practice focus on the prescriptions and all that. Let me know if you have any more questions. A couple people were throwing around some silly little statements. I don't know if they were like trying to get a rise out of us or what, but it's the dream team, baby. It's the dream team, and I love it. So all my resources that we're talking about, guys, everything about our programs and our coaching and our structure and our support is on the website that you can see above my head, weanoffmeds.com. So if you go to weanoffmeds.com, you can fill out the form. You can get yourself scheduled for a consultation, okay? A ton of content there. You can put in your information. There's going to be after you click the submit button, there's going to be a text message that gets sent back to you so you can get yourself scheduled for a consultation. All right, let's get into some questions. Good decisions to make me feel good. Sarah says, working out. I love it. MLC, I lost my job in everything when I was on semaglutide. I'm so sorry to hear that, MLC. Is there a way to avoid this? Oh, I lost my joy in everything. I was like, it's very rare to have any sort of psychological reaction like that, negatively speaking, regarding these medications. I have seen some rare instances of people having psychological regression. And so you absolutely should go talk to a primary care physician because that is a very unique and rare situation. Whoever's spamming that message, we are not talking about PPIs, protein pump inhibitors. We're talking about GLP-1s. So I'm sorry, I don't have any guidance for you on how to wean off PPIs. Hey, Nancy, welcome. Doctor, why didn't I lose any weight while I was on Mounjaro for 13 months? My A1C was great, though. So, Lucy, if you were taking Mounjaro for diabetes, that is probably why you didn't lose weight. So, what I have found in most cases, you got to beat the diabetes first before we can really get into some massive weight loss because insulin resistance, which is high in diabetics, it's also high in obesity patients too, but it's even higher in diabetics, is a roadblock to weight loss. So we need to get insulin resistance improved. We also got to become more fat adapted. We also need to become more metabolically flexible, and then we can get into some solid weight loss. Hey Joe, let me know if it's better on Facebook or not, or if you're still having some sound issues. I'm talking right into the mic, so it should be better. Um, I weaned off of Mounjaro, didn't gain back immediately, but after 7 months started gaining weight back. So the process, that's good that you were able to maintain weight loss for 7 months, but that's actually better than a lot of people. But you didn't get to that root cause yet. You didn't implement enough lifestyle choices to sort of be the transitional, right? To be the transition. So whatever you did, we need to do more of that. We need to reduce inflammation more. We need to become more fat adapted. We need to implement some more lifestyle choices. But obviously, some of what you did was in the right direction because 7 months is a long time. Dr. Jones, people should be trying to move their bodies while on these medications. Sarah, I absolutely agree that people should be exercising. There's a plethora of data supporting exercise and exercise roles on weight loss, but on health. But I can tell you that weight loss is not dependent upon exercise. It really isn't. Health, optimal health, is improved and enhanced uh, with exercise. But for weight loss itself, you don't really need to exercise as crazy as it sounds. Now, what is the best form of exercise? Right? What is the best form of exercise for implementing successful, lasting weight loss? That is resistance training. Resistance training is the best form for so many reasons because protecting lean body mass is crucial. Protecting muscle tissue is crucial long term for an individual to be able to achieve lasting weight loss. Plus, let me tell you right now, anybody who's ever lost 150 pounds or more never complains about having more muscle mass. But the complaints always come in from not having enough muscle mass, the loose skin, the weakness, the appearance, all of that is never good long term. But okay, does exercise help with constipation? Exercise can absolutely help, but constipation, what we do with our patients is we recommend extra magnesium. So magnesium in multiple forms, some threonate, some glycinate in the morning, threonate in the evening. Fantastic combination. Yeah, what was Kimberly talking about? All I saw was a bunch of emojis. I can't even get into it because we're getting easier. User 173. I was on semaglutide. I lost 16 pounds. That's fantastic. Felt great. But just got out of the hospital with a small bowel obstruction. Yeah, that's not good. I don't like the sound of that. Did they tell you to stop the medication? My guess is they told you to stop the med. I would too as well. I would stop the medication. And truthfully, maybe GLP-1 medications are not needed for you if that happens. It's not say what caused the bowel obstruction. I don't like the timing of that. That's certainly a potential side effect that nobody really wants to talk about. That's the reality, is that there are side effects. And so if that does happen with your body, then there might be other solutions for you that we need to consider. Putting this mic on, guys, just to improve the sound quality. Okay, good. Tell me if that sounds better. You guys told me on TikTok that it sounded good already. How do you address insulin resistance with PCOS? Great question, SP. So insulin resistance, the way that we handle insulin resistance doesn't change whether you have PCOS or not. It's funny. I made this video with PCOS. I have a patient, Melissa, and she's got severe PCOS. In fact, she's actually a creator on TikTok. You might have seen her. name is Melissa Marino. Uh, for me, she never really thought about the idea of putting out medications until she came across my program and my protocol. And now it's completely changed her life. But here's what it's like to have PCOS in terms of weight loss and health. If you have PCOS, it's like weighing 60 to 100 pounds more than you actually weigh. That's what it's like having on PCOS. So in other words, you weigh 200 pounds and you're on PCOS, and you have PCOS, it's like weighing 250, 280. 250, it's like weighing 350. Essentially, what I'm just trying to say is people with PCOS, you look at their weight, you look at their initial markers in health of where it should be, and it's just worse. More insulin resistance, more inflammation, more resistance from the body to change. But the good news is we still do the same thing to fix it. So how do we fix insulin resistance? We have to do the opposite of what created insulin resistance to begin with. So there's many theories behind where insulin resistance comes from, and one of the popular theories is chronically elevated insulin levels. The chronic elevation of your insulin level, right? We can talk about where that comes from, is what leads to the development of the resistance itself. And so now your body is releasing insulin, which is blocking fat mobilization, promoting fat storage, simply because it's resistant to the effects of insulin to begin with. So more insulin leads to insulin resistance. Resistance leads to more insulin. You guys see why this is such a hamster wheel. You guys have seen the TikTok, right? Where the freaking hamsters are running around on those wheels and they're playing the crazy rave music. I know you guys have seen that. I know I'm not the only one watching the hamsters. That's what it's like to have diabetes, by the way. That's what it's like to have insulin resistance. It's like watching those damn hamsters go on, and they're freaking crazy. You break that, right? Just like those hamsters fly off the wheel, you can certainly do that. But my point is it takes something aggressive. And so the flow protocol, which is what we do with our patients, this is our solution. This is why we have such a high level of success. Guys, you ready for this? You want to know what we do? We get our patients into a weekly rhythm of fasting for 36 to 48 hours every single week. And I know that sounds crazy, and I know that sounds wild, but if you didn't have this problem to begin with, if this weight loss maintenance resistance wasn't plaguing you and you were able to solve it, you wouldn't be here listening. It takes drastic measures to fix drastic problems. But I can tell you this, getting a person into a weekly long fast is so much easier because of the way we approach it, just with the tirzepatide, fat mobilizing peptides, all that kind of stuff. I see a lot of people hopping into the channel. Welcome, welcome. So let me do a quick introduction, and then we're going to get into more of your questions. So my name is Dr. Jones, and I am a holistic obesity expert. So what the heck is that? I own clinics. We service across the nation. Hello, Rizzy. Thank you, Blair. I own clinics. We service across the nation. We help our patients achieve lasting weight loss. Specifically, we help our patients by implementing the flow protocol, fasting, weight training, sleep optimization, stress optimization, resistance training, a dietary approach. We make it super simple. We put it together in a protocol, and we help our patients achieve that. And I'll tell you right now, fasting for 36, 48 hours simultaneously, one single fast every single week is hands down the most effective strategy, period. And I can go on and on about so many different reasons why that is so. So this is what we're chatting with. I want to know how we do this, how we accomplish. Thank you, Nancy, so much. Nancy's been with us for a while. Her body, if you don't mind me sharing, Nancy, has been a very resistant one. Lots of bumps in the road, but because we are working with her and addressing those underlying issues, why she's getting through those plateaus, she's getting through those issues, and she's continuing on. So Mercedes, how long would the fasting be? So we this is the world's most aggressive prolonged fasting regimen. Okay. So we have our patients, we help them again through the coaching and through the support, the medications and peptides. We get our patients into a rhythm of fasting 36 to 48 hours every single week. And boy, oh boy, do the results come flying. Our patients are losing about 1% to 1.5% of weight every single week. So let me know if that makes sense, if that's sinking in. And I want to get into any more questions you guys have about this. How does it work? But since there's so much of you guys that have just hopped in the channel, this is what we do every single day. So do me a favor, introduce yourself, your name, where are you watching from, get all your questions answered. Do me a favor and smash that like button up top. Let me know if you're excited to learn about weight loss and the best strategies. Share this live with anybody that you think would benefit from this sort of content. We are nonstop here putting out content to help you every single day. We do contests every 2 weeks where we give away peptides. Super exciting. You guys heard that right. We do free giveaways. And so every time you join us, it increases your chances of winning. So all you got to do is turn on your notifications and share the channel. And all my resources, guys, thank you, Melissa. All my resources regarding what we're talking about, the program, if you guys want to schedule a consultation, just so you know, we prescribe the GLP-1s, we prescribe powerful peptides like AOD, BPC, growth hormone peptides, all of them. Low dose naltrexone, thyroid management, hormone management, everything that we do to fix these underlying issues that drive weight loss, maintenance, resistance. And so the website is right above my head. I'm going to try moving it down here. See if that's a little better. The website's right there below my face, weanoffmeds.com. Be sure to get there, fill out your information, get yourself scheduled. Is Zepbound okay? Only thing I can get. Zepbound is great. Zepbound is phenomenal. The active ingredient of Zepbound is Tirzepatide. So, by the way, guys, if you are already have the medications, if you already have the peptides, that's fantastic. We can provide the coaching, the structure, the support. If you need both, you need the medication and or peptides, or you need one of them or neither of them, we got you covered. Go to weanoffmeds.com. Brooke, so I own the clinics. I employ medical practitioners. I'm a doctor of chiropractic, right? My background is functional medicine. And is the banner in the way, guys? Should I move the banner? I'll move the banner. And people are telling me to move the banner. Is that a better spot? Okay. Let's see. Um, User 1753. What to do now that questions or comments are going in fast? Yeah, I think I'm gonna make that graphic smaller next time. I think it's taking up too much space. Hey Jennifer, welcome. Um, Kathy, 7.8 pounds, 2 weeks from keto and fast. That's not here yet. Kathy, are you in my program? You sound like you're in my program. If you're already doing fasting and keto, that's great. Um, Giovanni, I honestly drink a ton of water every day, always have. That's great. Daphne, I had a gastric sleeve 2 years ago at 232 and now on 155. Good for you, Daphne. Sometimes the surgeries work, and so I'm super happy for you that it worked. How do you keep your energy up when fasting? How do you keep your energy up when fasting? When you are tired from fasting, it means your body is not fat adapted yet. So you have to become more metabolically flexible. And there's many ways to become more metabolically flexible. More fasting is the quick answer. But if you stay tuned, stay connected to us, we're going to teach you everything else that you need to know. Brooke, I just started Ozempic. How would we know we need read this? How will we know if we need your program? Brooke, well, I'm going to be as completely unbiased as possible as the guy selling you this program. If you are thinking that you want to lose this weight, you want to use these medications, but you understand the concept of, well, when I stop these medications, I'm going to gain the weight back. If you already understand that, then you need the program. I can tell you right now, if you do your research, you won't find anybody else. And I mean that because I research this every single day. You will not find other programs, other clinics, other people on TikTok talking about the holistic approach towards GLP-1 medication. I'm the only one. And I pride myself in that because I have such a high level of enthusiasm and excitement. I lost 100 pounds myself. I don't want anybody to have to go through what I did, which was a decade of being unable to maintain my weight loss. I see that I missed someone's question. If I missed your question, please ask me again. I'm going to do my best to get all your guys' questions answered. Not sure what to do now that semaglutide caused SIBO and I can no longer SBO. Are you talking about SIBO? If that is what you're talking about, you're definitely going to want to get the SIBO corrected. And if you can't use GLP-1 medication, guys, we have some awesome substitutes. If you guys are curious what we use to substitute for GLP-1 medications like semaglutide, tirzepatide, it is the tesofensine. So tesofensine, TESO, right? FENSINE. Tesofensine is a powerful triple monoamine reuptake inhibitor. Small bowel obstruction, same thing. Regardless of what the issue is, if you can't use GLP-1s, then we have to go to a substitute. And my favorite substitute, guys, for semaglutide or tirzepatide is tesofensine. So if somebody can put that in the comment and we can have a discussion about that, we can help get that medication and help you coach it. Ozempic is the new pain pandemic for greedy doctors. Well, Michigan, I'm going to leave that. I'm going to leave that up to you. Do I think we have a problem in this society with overprescription? You better believe it. This is why I'm sitting here trying to advocate for short-term usage, because I think the idea of adding more medications to a chronic list of medications for the rest of your life, that is a freaking problem. TESO, TESO, FENSINE, tesofensine. 1, 2, 3. So what are my credentials? So I'm a doctor of chiropractic and I own medical clinics. So medical practitioners work for me and we work together to helping our patients achieve lasting weight loss. So I handle the weight loss coaching and my practitioners handle the prescriptions. It's a freaking awesome combination. They do what they do and I do what I do. And that's what you guys are going to want. I saw a couple questions regarding Hashimoto's and various autoimmune diseases. And so we have some powerful options for you guys. If you have autoimmune disease, my favorite option is low dose naltrexone, powerful autoimmune support. Courtney, why do I still have an appetite? I'm still overeating and I've been on injections since Thursday. Courtney, is this your first injection? That means you are on the starter dose. You're going to be on the starter dose for 4 weeks. And then even after the starter dose, guess what? It still takes a few weeks to titrate up to the necessary dose that you may need to feel the effect. So be patient and be patient. That's like the best advice I can give you. But I should also tell you that I don't think you should only be waiting for the medication to be kicking in. Hopefully you're starting to make better choices. Hopefully you're eating better foods. You're trying to fight the food chatter. I'm not saying you're going to win the food chatter, because if you could beat the food chatter, you wouldn't need the med to begin with, right? But you should still try to do your best. Naltrexone, specifically, I was talking about low-dose naltrexone. That's an anti-aging use of the medication, which is FDA approved for other indications, called naltrexone. Yeah, LDN. So now Traxone was itself is itself FDA approved for drug addicts withdrawal symptoms, but the usage of about 10 times lower the dose. That's where people. That's the range, the dosing range for this low dose idea, and it's very, very, very popular in the anti-aging space. We use it all the time, and I can't tell you how many patients are just like raving about what LDN can do. We use it as a roadblock smasher, right? It's an autoimmune disease is a barrier to weight loss. And so we smash through that barrier with LDN. Remember, what are the three big roadblocks to weight loss, lasting weight loss? From a hormonal perspective, insulin resistance, inflammation, metabolic flexibility. Those are the culprits. Those are the roadblocks. So we are going to use various aids to help us take advantage of that, to embrace science. I am holistically rooted, right? I want to help you achieve optimal health with minimal usage of medications, but I'm not afraid of medications. I embraced it. So our program philosophy has always been ancestral wisdom, science. Um, Sandy, first week on Tirzepatide, been feeling really nauseous and stomach pain. Any tips to help? Uh, be patient with it, Sandy. Those are typical side effects. Should get better over time. You can try some digestive enzymes to see if that helps. Some ginger is really good for the nausea. Karina, what to eat on a prolonged fast? Nothing. You are supposed to eat nothing on a prolonged fast. You can drink water, coffee, tea. I'm okay with some nut pods creamer, but the goal is to get as close to 0 calories as possible. You are going to get some calories on any fast, whether it's intermittent or prolonged. It needs to be in the form of pure fat. Tesofencing. I got a couple questions about tesofencing. Tesofencing is my backup option for people who cannot tolerate GLP-1 medications. How many people watching this right now are in that situation where they cannot tolerate GLP-1 and they had to stop? I'm just curious. We can talk about tesofencing. Yeah, I see a couple people there. Uh, yeah, Matt, we absolutely could help with the low dose naltrexone. Yeah, I see a lot of people. Okay, so let's talk about tesofencing, guys. Tesofencing is what we call a triple monoamine reuptake inhibitor. TESOFENSINE. It was originally an Alzheimer's medication, but they found out that the side effect of weight loss was very powerful. It increases levels of dopamine, norepinephrine, and serotonin. It causes that reduction in hunger, reduction in craving, and it even increases your metabolism. Not even tirzepatide does that. Okay, I'm not going to sit here and tell you that it suppresses the appetite and food chatter as good as tirzepatide. That's why it's my backup. But we have helped a lot of people with tesofencin because there's a lot of people that can't, they don't qualify, right, for GLP. They can't tolerate the side effects. And so tesofencin is a really good substitute. So if you guys want to schedule a consultation about tesofencin, if you're curious, if you want to learn more, you can fill out the form at weanoffmeds.com and get yourself scheduled so we can discuss options with you. Sheila, I was on 0.25 Wegovy, started compounded semaglutide. Do I still do 0.25? So, Sheila, I can't give you medical advice, of course, but the active ingredient of Wegovy is semaglutide. 0.25 milligrams of semaglutide is the starting dose. Thoughts on metformin for treating insulin resistance? Caitlin, metformin does not treat insulin resistance. Let's be clear. What's the definition of treat? I guess it depends on your definition of treat. If your definition of treat means manage symptoms, then yes, metformin does that. If your definition of treat means get to the root cause, metformin doesn't do that. Metformin is definitely one of my more favorite diabetic medications out of the many out there. After GLP-1 medications, metformin is my second favorite before any of the others because all the other diabetic medications cause weight gain, except metformin, which causes a little bit of weight loss, and GLP-1s cause a lot of weight loss. Explosive diarrhea is definitely a potential side effect for metformin. So I do apologize. It could have been very explosive for you. Uh, uh, are semaglutides safe, or was there enough studies for cancer causes? So, look, GLP-1 medications are approved by the FDA. What does that mean? It means they're relatively safe. That means for most people taking them, they're fine. Are there some people that are going to have some extreme consequences for taking these medications? Yes. But if you're suffering from obesity, insulin resistance, PCOS, I think you're worse off staying overweight. I really do, than these medications. So you shouldn't take these medications lightly. You shouldn't sleep on them. There's no free, what do they say? There's no free breakfast. What is that expression? There's no free rides. I'm butchering that one, but you know what I'm saying. Like there's definitely a cost to them, right? Um, so what's the biggest thing that I teach you guys? Oh, no free lunch. Did I say no free breakfast? I'm like, no free breakfast. I don't eat breakfast. So no free lunch, right? Thank you, Kim. Oh man, that's funny. Do you know about the reaction with tirzepatide? Do I know about the reaction? I don't know what you mean by that. 50% of people will have a nausea reaction. Less than 50% will have some diarrhea, and even less will throw up. How long can you stay on LDN? A lot of patients stay on LDN for years. There's certainly much worse things to be stuck on for the rest of your life than LDN, Kelly. Although with us, our goal is to always replace medications with lifestyle as much as we can. Think of LDN though as the last medication to worry about. Seriously, it's FDA approved at doses that are 10 times as high. So keep that in mind. LDN is very safe. So which GLP is better for losing weight? The literature is very clear that tirzepatide is better than glutathione, without a doubt. Ashley, itchy and rash after injection. You're going to have to talk to your prescriber. You're going to have to talk to the doctor who you're working with. If the side effects get worse, absolutely. If they don't, then maybe you can assess over time and make a decision. Susie, I've been on point 25 with Govi 3 weeks and gained a pound. Why is that? Well, that means you likely ate at a caloric surplus relative to how many calories your body burned. You might be in a plateau, so maybe you didn't eat that much. Also, 0.25 is a very low starting dose. But I'm curious, whoever asked that question, how long have you been trying to lose weight for? I wonder if you were already in a plateau. Guys, I see a lot of people hopping into the channel. So let me do a quick little introduction, and then we're going to get back into some more questions. So welcome, welcome. My name is Dr. Jones. I am a holistic obesity expert. I own clinics, and we service across the nation. Okay? Me and my medical practitioners, we service across the nation, helping our patients navigate around semaglutide, tirzepatide, coaching them. Whether you have Ozempic, Wegovy, Mounjaro, Zepbound, whether you have compounding pharmacy medications, whether you have nothing, we can supply you, we can prescribe you the peptides, the medication, both LDN, thyroid management. If you have low dose, if you have issues with your thyroid, thank you, Kylie. Whatever it is, whatever the roadblocks may be, I think what's really cool about us is we have a very wide menu of options in front of us. We understand how to use them. We're not afraid of these science-backed options, right? Like that's a big thing. But then at the same time, you're looking at the man who created the protocols. You're looking at the passion that I have behind designing this. Philosophy has always been the same with my clinics: reducing prescriptions, preventing surgeries, restoring optimal health. That has always been my passion. as long as I've been helping people. And it'll continue to be my passion until I'm done helping people, which hopefully is the day that I no longer exist. So that's the promise you're going to get from me. And that's the sort of overlying um, drive that all my medical practitioners have. We all feel the same way. We're not afraid to use medications, but we use them sparingly. We use them for a purpose. Can Tirzepatide make you really irritable? I haven't really seen that happen to a lot of people. Do you have appetite suppressants? Yeah. Semaglutide, tirzepatide, phentermine. We have all sorts of appetite suppressants. Thank you, Blair. I really appreciate that. Rachel, I have been on GLP-1 for 5 weeks with no weight loss. Any tips? Well, with your fifth injection, did your prescriber work you up to the clinical dose yet? You're probably still at a low dose. If you do it the standard protocol, it takes about 8 weeks to get to the highest dose. Hopefully, you never have to get to the highest dose, by the way, because if you think about it, the higher the dose that you take, the harder it's going to be to wean off. You don't want to be stuck. You don't want to have to take the higher dose. If you really think about it. Is hair loss a common side effect from Tirzepatide? Guys, I got to be honest with you. I used to have a head full of luscious hair. If you don't do Tirzepatide right, you can lose all of the hair on your head. Please learn from my mistakes, guys. This is what happens if you don't do Tirzepatide right. I lost all my hair with Tirzepatide, and I just want to let people know. Wait for something. So many people were like probably freaking out when I said that. I'm totally kidding, guys. I'm totally kidding. Yes, yes, yes. You guys like how I kept that straight face for like a good. I had to make. No. Uh, it's funny. Hair loss. It definitely runs in my family. Sorry. To answer the question, I know people probably just hopped in, and that's the first thing they saw me say, and they're like freaking out. Totally kidding. When it hair loss is not a side effect of these medications. We'll just leave it at that. Missy, I think this is like the best uh, option that we have out there for lasting weight loss, specifically when it comes around these medications. There's nothing more powerful out there. How much does our AOD cost? Ava, we have about 4 more weeks probably before our compounding pharmacist is out of AOD. It's crazy. We got about 4 more weeks left. I was just talking to the compounding pharmacist. It depends on what sort of dose you want. Probably around 500 a month for the AOD. Depending on what kind of dose, you can go on a double dose if you want, and then there's discounts. If you guys are looking, I know there's a lot of people, about 100 of you that just hopped into the channel, so bear with me. I'm going to do a quick introduction. All of the resources that I'm talking about, guys, my coaching, my prescription, my medication, all that, there's a website above my head called weanoffmeds.com. So if you go to weanoffmeds.com, you can fill out the form, get yourself scheduled for a consultation at weanoffmeds.com. There's a ton of great information that'll be sent to you where you can get all of your questions answered. You can schedule a free consultation. Hey, Mr. Music, welcome. So thank you, Kylie. We are doing pretty good right now. This is awesome. Do you have any helpful? Eve, I have a ton of helpful stuff. I'm not sure what kind of help you're looking for, but whatever it is, I got you covered. Assuming it's talking about the stuff that I help with, which is lasting weight. Yes, a lot of great intel on helping people with menopausal induced weight loss. So I'll tell you guys right now, in a nutshell, when it comes to menopause, the deal is a massive increase in insulin resistance, inflammation, metabolic flexibility. These are the issues that people with menopause, specifically when they get to menopause, it's like, bam. And the menopause triggers, and now they have difficulty losing weight. And so this is where the aggressive fasting comes into play. So for our patients, we work them into very long weekly rounds of fasting. This might sound wild, but bear with me. 36 to 48-hour fasting every single week, right? This is crucial and such an important piece of our program. Out of everything we do, when people ask me, what is the most powerful intervention that you are aware of? Hands down, prolonged fasting. Nothing compares. You guys might have heard like all this, you know, is it all about hormones? Is it all about calories? We can have that conversation all day. And I'm sitting here saying, I know hormones play a big role. But even if they didn't, even if I was wrong, I would still argue for fasting because guess what? Fasting is still calorie restriction. And what sounds easier to do, guys? Suppress your appetite and not eat for 2 days and then eat whatever you want for 5 days? Or trying to sit there and worry about eating 500 calories less every single day? You guys tell me what sounds easier to you. I'll tell you right now, the majority of people would say I would rather just suck it up for a day or two, suppress my appetite, make it easier, and then enjoy my other 5 days. Now, not only do most people think that just practically pans out to be easier, but it also makes massive improvements in your insulin resistance, inflammation, and metabolic flexibility. What about being type 1 diabetic? Melissa, that's a tough one. That is a tough one. There are fasting programs for type 1 diabetics, and I stay away from type 1. That's just not what I specialize in. Um, and so, unfortunately, it becomes a lot more difficult when you have type 1. Deborah, not eating is easier. Yeah, that's what I think, Deborah. You guys want to know how many calories? What do you? Let's do a vote here. Um, 2 days of fasting is equal to how many hours of exercising, guys? Thank you, Amber. What we're talking strenuous exercise. We're talking about intensive exercise. How many hours of intense exercise equals 2 days of not eating? What do you guys think? You got 12 hours. What else? Let's do a couple more votes here. How many hours of intense exercise would be equivalent to uh, a full 48-hour fast? So we got 3, we got 5, we got 12, we got 10, we got 24. That's a lot of exercise, Herman. We got 24, we got 4, we got 36, 12. The answer is 8 to 12, because obviously it depends on how intense your exercise is. 8 to 12 hours, right? The average person burns about 15 to 2,000 calories a day. So if you're not eating for 2 days, that's about a 3 to 4,000 calorie deficit, which would take about 8 to 12 hours of moderate to intense exercise. I don't know about you guys, but I would much rather enjoy all that free time, not worry about exercising, get all the health benefits of fasting, including the extra time, and burn the same amount of body fat. Let me know if that makes sense. Let me know if you would much rather do that, because I got the ways to make it easy for you. I got the ways to make it so that that's not hard, because trying to fast for 48 hours right off the gates, yeah, of course that's challenging. I'm not telling you to go do that. Don't go try to fast for 48 hours. Kudos to you if you listen to my stuff and you try that. But no, you got to work into that. Does fasting mean water only? No, Virginia, that's a great question. Coffee, tea, all your vitamins, all your minerals, including fish oil. So you are still going to have some amount of calories, just very, very low. What are you allowed to intake for the 2 days? We just talked about that. What is your definition of fasting? My definition of fasting is as close to 0 calories as possible. Coffee, tea, water. You have to add electrolytes. You have to add extra sodium specifically. And I want you to get your essential fatty acids. So it won't be a true 0 calorie fast, but literally if you're eating 30, 40 calories of fat all day long, that's it. The cost of my Tirzepatide is no different than the cost of Tirzepatide from many other platforms that you see. Um, we have like I can't even think of all the different companies out there selling GLP-1s, but basically a couple $100 a month. Depends on your dose. But then when you talk to our team, we're going to talk about coaching, we're going to talk about structure, support, and all the other things that are vital for long term. Oh, thank you, Dora. I appreciate that. Someone else said I look tired and old right before you. So I got to take the compliments alongside the mean comments. Yeah, Brenda, we do 100% telemed. So we service across the nation, and everything we do is virtual. My coaching, the prescriptions, all of that. I see a few of you guys uh, have just joined the channel. You guys did fill out the form, but some of you guys did not schedule yourself. So Sonia, Marie, Susan, thank you so much for putting your information in. You should have gotten a text message that says you can click the link to get scheduled. So be sure to respond to that and get yourself scheduled. Deborah says, I've done a 48-hour fast trying to do 72. You get it, Deborah. You got it. Thank you guys so much for the kind comments. I didn't think I looked that old. I know I've always looked more older. Maturity-wise, I've always told that from as long as I can remember. But no, seriously, you guys wouldn't even believe it if I told you this. There was a lady in one of my lives who was her name. Some of you guys remember because you were there. Blair, remember her name was Grandma. It was Grandma something. Grandma was like, "How old are you? You look like you're 60 years old." I was like, "Man, what's up with Grandma?" But anyways, thank you guys. Yes, if you guys want to schedule a consultation, go to weanoffmeds.com. Right above my head, guys, there is a wean off. Let me bring it down a little bit. Let's try that. You guys can see that there. It says weanoffmeds.com. We try it. One of you guys was there when Cranky Grandma was there. Kylie, I think it was you. I'm not sure. But she was just going hard. Or maybe it was Amber. Can you have pickle juice? I'm all for pickle juice during your fast. That's fine with me. There we go. So a couple people are asking to talk more about fasting and GLP-1s. So thank you, V77. So fasting is the act of existing over time, right? A period of time where you're not eating. We know that. Intermittent fasting is simply referring to the daily. Instead of eating throughout the day, you just compress your eating hours, right? So maybe an 8-hour eating window where all of your calories for the day are in an 8-hour window. But then what I'm talking about, guys, where the real magic starts is prolonged fasting. Prolonged fasting is where, for a lot of us, you're not even going to feel the benefits of intermittent fasting. And I think this is what, unfortunately, why a lot of people try fasting and they're not impressed with the results. They're not impressed with the results because they just didn't do it enough. They didn't do it intense enough. If you have more than 20, 30 pounds of weight to lose, I'm sorry. Intermittent fasting is not going to cut it. You need to get into some deeper rounds of fasting, and the deeper rounds of fasting are longer periods. So with the flow protocol, the center of the flow protocol is what we do is we get our patients to that 24, 36, 48-hour mark. No, we coach. So if you live in Canada, if you live outside of America, our coaching programs extend all across the world. We just can't provide the prescriptions, unfortunately. How long do you suggest a fast while on GLP-1s? So our patients and our program are fasting the entire time of the program, right? Like right from the get-go, we start intermittent fasting, but then the goal is we are trying to get them to the point where they can fast for 36, 48 hours. Amber can tell you, Amber, how many weeks of trying to fast did you get to the point where you were able to fast for 48 hours every single week? How many weeks? Fasting is not just for weaning off. If you don't do fasting during your weight loss portion, um, I'm not saying you have to fast to be successful. I'm saying it's going to be a lot harder. I was coming up with a hook for my hour-long fasting video. I'm putting out an hour-long fasting video that gets in. That's very, very powerful, and I'm going to put it out there for everybody for free. And there's so many videos about fasting, right? So like, what's going to be special about mine? It's going to be about everything that you need to know about why fasting needs to be part of your lifestyle. Now, yes, fasting helps with autoimmune conditions so much. Fasting reduces inflammation. Fasting improves insulin sensitivity. And there's so many people right now that are parroting off literature and they don't understand the bigger picture of what else fasting is doing besides weight loss. Thank you, Benson. Protein is an important macronutrient when you're not fasting. When you're fasting, you want no protein. You want no calories. Your body needs the benefit of that period. So much takes place when you're fasting for long periods of time. Yes, absolutely, Matt. The benefit of long fasting is forcing your body to get into a state of ketosis. I use nut pods, and I'm a big fan of nut pods, Kathy, during your long fasting windows, about a tablespoon or two. Okay. Rosie, I apologize if I ignored your question. Please ask me again. I will totally answer your question. Yvette says, I'm tired of being fat. Well, Yvette, let's get you no more. Let's get you away from the fatness and let's get you into the goals. This is what we do. This is where we specialize in. So we can help you fix this, Yvette. We can beat this for you. Just trust in the process of what I'm advocating. What is a nut pod? Nut pod is a sugar-free, dairy-free creamer that's available at most stores. Can you answer my question? Absolutely, Carmen, but I'm going to need you to ask it again because there's a lot of questions flying at me. So I apologize for the question, but I'm totally going to do my best to get to all of your guys' questions. So thank you for being patient. How much can you lose in a 48-hour fast? Holy moly, you can lose a lot. So on the scale, you can lose 2 to freaking 8 pounds in a 48-hour fast. Now, you are going to gain, after you start eating again, about 2 to 4, 5 pounds. You're going to regain 60 to 70% of that weight, but you're going to have net loss. And so I would say if you lose about a pound of body fat, a pound to a pound and a half of pure body fat throughout an entire 48-hour fast, you're crushing it. You're doing really, really well. No food for the 48-hour fast. You want to have lower calories. You want to have as close to 0 calories as possible. But if you are going to have calories, it's basically your fish oil, maybe a little bit of nut pods creamer, coffee, tea. Those are okay. Briella, I've gotten off these drugs and I'm gaining weight, even still at a deficit. Yeah, Briella, we get so many calls from people just like you who are crashing miserably when they're off medications. Unfortunately, that is what the literature says is going to happen, which is why many people are going to tell you that this is a chronic disease that requires lifelong medication. I can tell you, if you do my program, I have a high level of confidence that we're going to help you to break that issue that you are running into right now. Can you tell me anything about retatrutide? So, yeah, I mean, retatrutide is going to be a big deal when it comes out. It's a triple agonist. So, semaglutide works on one set of receptors, tirzepatide works on 2, and retatrutide works on 3. I think for extreme diabetics, I think for very obese people, it could be a good option for them. But truthfully, tirzepatide is powerful. Tirzepatide is extremely powerful. And I haven't ran into patients who I sat there and really experienced like the need for stronger meds. So, but that's because we don't rely on the medications, we rely on the lifestyle. Plus, we're doing the fat mobilizing peptides as well. Which is yeah, Matt, every 2 weeks or so, give or take every 2 to 3, we're doing another contest, another giveaway. Giggles. I'm not an eater. I have to be asked if I need to eat. So does fasting work. Um, there's a lot to that, Giggles. We would have to get into some coaching with you, but basically, as long as we coach you on how to address that, shouldn't be an issue. Should be no problem. Um, is it possible to heal thyroid photos? It is. My background is functional medicine, so I used to help people all the time with autoimmune diseases, and beating a pure autoimmune disease is not easy. So I would say let's deal with your autoimmune disease. Let's get the weight off your body. Let's heal it. Let's improve it, and let's take it from there. How is the Zepbound? I think that's what it's called. What about Zepbound? Zepbound, the active ingredient is Tirzepatide. It's very powerful. What questions do you have? Is fasting more than 48 hours beneficial? Recommended. Um, Anything more than 48 hours certainly is on the table, but not every week. For me, 48 hours every single week is about the most I would want people to do, and that's only when you have extra body fat to lose. That's as a regular thing. Oh, thank you, Nancy. So True has been in my program. She's had a difficult body to work with. Even in my program, she had some hiccups, but she stuck with it. She listened to me, guys. That's the key. You got to listen to me. You don't listen to me, I can't help. Let's see. Hey, sorry. Somebody pinned her question so I can get to it. Um, if I missed your question, one of my moderators you can ask my moderator to pin it, and I will answer your question. I mean, I usually they don't have to pin it, but there's a lot of people in here. How do you curb your hunger during the fast? Uh, oh, thank you. Tirzepatide, D helps a lot, and there's other supplements too as well that can help, like Tirzepatide. Um, we have tesofensine, we have Unimate, we have Calicur, we have a lot of supplements too as well. Can fasting on semaglutide cause deadly hypoglycemia? How can you prevent that? If you asked that question before, I apologize for missing that. That's a juicy one. I love juicy questions. You guys didn't know that already. Um, I do wonder why you said the word deadly in front of hypoglycemia. Um, I mean, can you die from hypoglycemia? Yes, you could. So, is it rare? Yes, it is. But so let's talk about that. If you are on a bunch of diabetic lowering medications, your doctor prescribes these diabetic medications to manage your blood sugar based off the fact that you're eating. So if you start fasting, you are going to produce lower blood sugar. So you always have to talk to your doctor, your primary care physician, whoever is prescribing these medications. They need to prescribe it for you, knowing that they need to change your dose, knowing that you're going to start fasting. And so always speak to your primary care physician regarding these medications, regarding any blood sugar lowering medication upon starting a weight loss, starting a fasting program. Oh, no problem, Rosie. Yeah, I think the truth of the matter is, um, if you're a diabetic taking insulin, I would say that's where it becomes a lot more tricky, and that's where you got to be a lot more careful. What else can you do to control appetite? Um, without the medication. My favorite appetite suppressants outside of these medications are. I'm going to stand up too because I kind of feel like standing up now. Some of my favorite appetite suppressing supplements are Unimorpho from Unicity. I like the Balance product. I like Polycurb. Um, Even the use of exogenous ketones can be very helpful as well. I've been on my last month and I'm scared to get off. I'm in healthcare. Hey, Christy. Well, thank you for sharing. I get it. I understand the idea and the concept of why it might be scary, but truthfully, it was probably scary at the beginning when you started the weight loss program, right? Any change is going to be scary. Like we just need to get that out in the open, right? Change is scary. Okay, great. Well, time it gets less scary. Over time, we can't live a life where we let fear impinge us. We cannot let fear prevent us from taking the next step, from taking that leap and making that change. So, the ability to get to the point where you can live off of these medications depends on your ability to be able to implement proper lifestyle choices. Anthony took second Wegovy shot and serious GI issues. It's been 5 days straight. Anthony, I would go to the hospital then. That sounds really serious. I would go to urgent care if that is really what's going on. Yes, you can take uh, Unicity teas alongside GLP. Lewis, yes, I'm actually currently taking BPC and PD 500. My clinic also prescribes it. What kind of questions do you have? By the way, that's powerful musculoskeletal. I call it Wolverine healing, but what about slowing metabolism and the body holding on to fat, fear of starvation? So I have a very powerful video on weight loss plateaus. Um, find that on YouTube, but basically, the nutshell of a weight loss plateau is triggered by calorie restriction over time. So calorie restriction over time triggers the body to slow down the metabolism in an attempt to stop weight loss. So you have to slowly increase your intake of calories. You need to do the opposite. The opposite of what got you into a plateau is going to be the thing that gets you out. Okay. So reverse diet, increasing your calories. That's how you beat a weight loss plateau. And yeah, let me know what kind of questions you have. If you guys just hopped in, and I know I've been talking about a lot of different things, if you guys want to access any of the resources we're talking about, if you want to schedule a consultation, if you want us to help you beat your weight loss plateau, get this in the butt, lasting weight loss, we have a 94% success rate. Please go to the website right here, weanoffmeds.com. So if you go to weanoffmeds.com, fill out the form, get yourself scheduled for a consultation, and let my team get this ball rolling because there's so many pieces to this, and we want to ensure that you are successful. Caitlin, thoughts on using tirzepatide and metformin? So this is a very obviously nuanced, technical thing, and I'll respond to Tony if I have time. I love comments like that. It's hilarious. I'm not going to waste my time with other people that actually have real questions, but if I have time, I'll get to so you're gonna have to talk to your medical practitioner if you are considering using these medications. Diabetics use multiple medications all the time. So if you're a diabetic, you might need more medications. But if you are a person losing weight and you're not diabetic, then you probably shouldn't be using multiple blood sugar lowering medications. Sarah, what's up, Sarah? Did you just hop in? I don't even. What did Tony say? Stay in my lane with massages. If you're gonna do an insult, get it right. That's hilarious. Probably good that you muted him, Ying, because I don't want to waste my time with that. You expect fasting to help with skin changes from rapid weight loss? I think so. Truthfully, though, like don't get sucked into any of these things. Like loose skin is inevitable with weight loss. The more you lose, the faster you lose it. The more times that you yo-yoed with your weight loss, you're going to have loose skin. It's just it sucks, right? So the things that we know may be able to help loose skin. I actually think fasting does help loose skin because if you think about fasting, your body is breaking down non-essential tissues when you fast. Loose skin is a non-essential tissue. Resistance training, building muscle mass, collagen, proteins, and peptides. If you do want to make an investment in something that may help, GHK copper peptide cream that actually stimulates the stem cells locally too as well. You're welcome, Christy. Thank you. Candace. Hey, Candace, I haven't seen you in a while. Yes, I would take loose skin over metabolically wrecking body fat tissue. That's for sure. Where should I start? I'm 27. I'm over 400 pounds. Lots of health issues, including fluid around the heart. Well, first of all, hey, Hall, it takes courage to put that out there. You're 27 years old. You're 400 pounds. It's scary. But guess what? Here's the good news behind that. You are 27 years old. And as scary as 400 pounds is, your ability to bounce back and recover is significantly higher than even 10 years. That is a long way, though. So we need to get the ball rolling now, and we need to get that weight up. So the starting point would be intermittent fasting right off the get-go. Start eating in smaller windows of time. And number 2, reduce your consumption of carbohydrates, replacing it with more healthy fats. Number 3, resistance training. Number 4, I think you're going to need GLP-1 medications. If you weigh that much, you have a ton of food chatter. You're going to need these medications to be able to get in front of these food chatter issues in front of you. And then obviously my program, we can put it all together for you, coach you, guide, structure it, all of that. Am I aware of Ozempic peptides to be reconstituted, listed as research? Sherry, I think what you're saying is people are going online right now to research companies and they are buying semaglutide and tirzepatide. Is that what you're referring to? Salinas, wish I could get this. I can't afford it without insurance. You'd be surprised, Salinas. You can get a compounded medication for a couple $100 a month. And we do offer as well. So at the end of the day, if you can only afford one shot at this, I just did a podcast last week talking about, I literally answered that question. What would I tell somebody who told me, Dr. Jones, I can only afford to do your program once, one shot, and that's all I got. I can tell you guys right now, to my core, to my soul within, this would be the program that I would have my loved ones do, because I don't know of another program that's looking at the entirety from what we're looking at it, from where we're looking at it, and the kind of passion, enthusiasm, and confidence I have to help you get the most bang for your buck if you got one shot at this, financially speaking. Is Ozempic used for type 1 diabetic? Potentially, but that's a question for your primary care physician, whoever is prescribing you. Christy, what does your program entail? New here. Oh, you got to be kidding me. Seriously? Ability restricted. Oh my gosh. Um, welcome everybody. So I just got some weird little TikTok notice, but it doesn't seem to be an issue so far. So welcome guys. If you just hopped into the channel, my name is Dr. Jones, and I am a holistic obesity expert. I really because I noticed docs something, but I see a lot of people here. By the way, we're at a record right now. Record in my live. This is super exciting. Guys, thank you so much. If I miss your question, I'm not going anywhere. I will keep going all night. This is super exciting. I've never had this many people on. So my name is Dr. Jones. I help patients with weight loss. I bet you somebody reported me that he has a high level of success at helping people achieve lasting weight loss. So whatever your question is, whether it's about semaglutide, whether it's about the medications, whether it's about powerful peptides like CJP, whatever they are, please start by introducing yourself. Let me know your name, and I give a service to you. All my resources, everything we talk about is right in leanoptimal.com. Yes, your vitamin very, very all my patients, we inject all their vitamins, all their minerals. Most thing though is electrolytes. Electrolytes. That are a big deal. You will feel it right away if you are fasting. You do. So candidates want to tell you 90 today, down 51 pounds. Your info through the road. I love it. I want that. Thank you so much, Candice. The weirdest thing someone put me up. I want to know in my category, and this is what I think out right now on the program right now. There's nothing like it in terms of the picture and everything. Thank you so much for your kind words. Berberine is great. Berberine acts like metformin. Strong as metformin, and it blocks the release of glucose from the liver via block glycogenolysis. So, end result is lower blood sugar. Oh, I really, really appreciate that. Yes, salt, lemon water, but you also need a complex blended electrolyte product. You need the extra. So a sugar-free electrolyte product alongside the sodium as well. Horrible hunger pains even after a meal. Horrible hunger pains even after a meal. I've never heard that. You shouldn't feel it. That sounds like something else. Give me some more context for that. Give me that answer that. Do electrolytes break the fast? Not if there's no sugar. No sugar, carbohydrates, and no, fine, it's not going to break the fast. The same MT2, and for my experience personally trying MT2, I would say MT2 makes you tan like freaking crazy, but I just didn't. I actually don't know how MT2 is on it. I transfers with that. I would say personally, that's just my anecdotal opinion. So, somebody in the program just shared, Dr. Jones, I think your program lowered my A1C currently 62. Lower the 5%. Awesome, gold mine. Thank you so much for sharing that. Anybody watching right now in my program, and please let me know how far questions. Nancy, what do I think? I haven't heard it. But I actually am going to agree with what Kathy said right below you. That's my favorite electrolyte. As long as there's no sugar in your electrolytes, they're fine. No sugar, I'm okay with it. It's really hard to mess them. Electrolyte product, it's really hard to mess that one up. Does having a higher A1C make it slower to lose? Absolutely. User 168, having a higher blood sugar level. A1C, glycosylated hemoglobin, is a measurement of the average of your level over the past 3 months. That's what A1C tells us. The higher that number is, it means the more insulin resistant you are and the more difficult weight loss is. So when I work with patients, usually we are reversing and beating the diabetes first before we can really tap into some great amount of weight loss. Yeah, Matt, we actually prescribe MOTS-C as it is now. But I don't talk about it as much. MOTS-C is pretty awesome. MOTS-C is pretty amazing. Um, it literally repairs mitochondrial DNA. It improves insulin sensitivity. It improves metabolism. That one's amazing. It's more expensive, and so I'm always trying to bring the cost down as much as I can. You don't need MOTS-C to be successful, but if you can afford it, MOTS-C is pretty freaking awesome. I'm thinking of taking MK and glutamine. I get the concept. You're young. I wouldn't be messing with MK at your age, though. Your growth hormone levels are already extremely high, Lewis. Uh, Testosterone levels, though, I don't know. So maybe there's a need for optimizing your testosterone, but the MK, I would say, away from, to be honest. You're too young, man. That's lectin levels, and if you really want to optimize it, there's safer increased growth hormone like morelin or CJC 1295, ipamorelin. I'm not a fan of MK. I take metformin alongside my GLP-1 to lose weight. I can't give you medical advice, user 168. If you're diabetic, your prescribers might recommend both medications to control your blood sugar. But as a standalone, if you're not diabetic, no, I would not just add metformin willy nilly. You would need to be working with some sort of licensed healthcare professional. Like, for example, if you sign up for our program, work with us, I have medical practitioners, right? So it's nice combination. I own the clinics, guys. If you just hopped in, my name is Dr. Jones. I'm the owner of our clinics. I published my book, Fast Feast and Flourish. It's the only guide, it's the only book you can find right now on the topic of utilizing these medications and weaning off. Get it on Amazon. Please follow the podcast and all the different platforms. But this is what my clinics specialize in, is using these medications in a format that we focus on the lifestyle. We use these as tools to eventually wean off. That's the big picture. That's the name of the game. And that's what the focus should be, in my opinion, if you're looking for the best results long term. So all of the different resources and everything I'm talking about, you guys can access that. Thank you. You can access that at weanoffmed.com. How much water should you drink? Ashley, it's really important if you're taking GLP-1 medications to be trying to stay hydrated. A lot of people become dehydrated on GLP-1s because literally these medications are so powerful that people forget to drink water. So don't let that happen to you. Make it an effort to consume, to drink enough water. But also, if you drink too much water and not enough electrolytes, that can also be a problem. So you need to do both. You need to stay hydrated. You need to drink adequate water. So if you want a formula, if you are trying to measure your water intake, to stay conscious about it, to stay cognizant over it, about 60% of your body weight in ounces of water is a pretty good formula to follow. Dora, let's see. If I was to go off my meds, I would be in a lot of pain. What do you mean by that, Dora? What meds are you talking about? Dr. Jones, I currently have leg swelling when I drive, but at night I sleep and go away. Yeah, gold mine. That's not great. It's not great. Signs of swelling could be many things. If you want to mess around with that, I would go see your primary care. I would get a couple ultrasounds of the legs. I'll check out your cardiovascular system, lung issues, and any type of venous insufficiency. I would get all those major things ruled out first. And if the doctor says everything's fine, then that doesn't mean everything's fine. That just means you don't have something that is a known disease. That's all that means, by the way. Guys, when you have symptoms and you go to your doctor and they do all the blood tests and they do all the physical tests and they tell you you're fine, but you're sitting there and you're saying, I'm not fine. I have blah, 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 blah symptoms. Okay. That just means you don't have a known disease. You don't have a documented pathology that has a coexisting drug surgery solution. That's all that means. It's actually good, though, when they tell you that, because that means it's probably not as extreme yet, but that doesn't mean that you should go back to thinking there's no problem at all. Oh, my God, I'm just crazy. No, you're not likely crazy. You have something going on. It means your body is deviating optimal. Your body is not operating as efficiently as it could. And so we need to get the basics in. We need to implement the core foundations for optimal health, right? Yeah, like Sarah says, always advocate for yourself, okay? So what are the pillars of optimal health, right? Improved food intake, eating less processed foods, fasting, lowering your carbohydrate intake, resistance training, supplement routine, minimizing your stress, optimizing your sleep. If you just did those basics, you would be in a world of improvement compared to where you are at. So please, 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 I can't stress that enough. You're welcome, Goldmine. This is my life. This is my passion, and I will not stop doing this. No matter what social media platform wants to impede in my way of delivering this intel, you can't stop me. Dip 65. I am 182 pounds. I am not eating junk food. Still, it will help. I'm not understanding the question. Are you asking, even though that you don't eat junk food, will these medications help? Probably if you're overweight. I need more context. What supplements should we be taking daily with GLP-1 medications? The basics. The basics are always what matters the most. The basics are magnesium, vitamin D, essential fatty acids, a good blended multivitamin or greens product, curcumin and resveratrol. I put that on the essential list for most people. And then electrolyte, sodium, and fasting. If you're following my program, fasting is a must. Diana says, I'm hungry and I'm tired. Well, that sucks, Diana. I'm sorry. Are you just talking like generally you're always hungry and tired, or give me some more context? Hi, Doc. When are you going to be posting your video on fasting? The one that I was talking about earlier, that one probably not until next week. I'm filming that one Thursday, and that one will be posted next. All the longer format videos I've been those are all on YouTube. Guys, I have a phenomenal video that I just posted on YouTube, a 45-minute video on weaning off his medications. So if you guys want, because you're not going to get it all here uninterrupted because I'm doing the live, I have a ton of these. Most recent videos I posted are really, 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 really thorough. You're welcome. Supplements for sugar cravings. Believe it or not, one of the most powerful supplements for sugar cravings is glutamine. So glutamine is a non-essential amino acid that also is really, really important with healing. And it can help tremendously with sugar cravings. Taking it up to 3 times a day, 5 grams. I would get the powder so you're not taking so many pills. Where can you get Mossy? You can get Mossy from us. If you go to weanoffmed.com. You can fill out that form and get yourself scheduled for a consultation. Oh, I see they just restricted my live, and TikTok just will not stop. That's so crazy. Yeah, it's interesting. It does look like that's a good point. Yeah, that's a good point. Should I try that? Let me try logging out and logging back in. Let me do that, guys. If you guys mind, I'll log out and I'll log back right back in. Hey, man, I feel like TikTok is gonna keep trying to throw new things at me. This is crazy. Yeah, I don't know what that is. It said fake engagement. It said it was the weirdest thing. It said fake engagement. I don't know what that means. Thank you, Diana. I appreciate that. I'd like to know. I mean, I want to play by the rules. Just tell me what the rules are. If I knew what the rules are, I would play by the rules. But if you don't tell me what the rules are, so crazy. Yeah, guys, let's get it. Let's see if we can build it back up here. I'll probably what is it, 8:30? I'll probably keep going here. Welcome, guys. If you just hopped in, my name is Dr. Jones. We are chatting about lasting weight loss solutions, how to navigate around semaglutide, Tirzepatide, specifically utilizing these medications in a format so that you're not stuck on them for the rest of your life. This is what we are chatting about, and this is what we have the answers to. I feel like we really cracked the code when it comes to accomplishing lasting weight loss. So, do me a favor, guys. Introduce yourself. What is your name? Where are you watching from? Are you taking semaglutide? Are you taking tirzepatide? And how's it going? Is it going good? Is it not going good? Let me know, and let's get into all of it. Blair from Massachusetts. Amber, I wonder. Yeah, I wonder if it's something. There might be certain words that I'm saying. I'm really curious. It could be it. Totally could be it. Hello, why not from Toronto? What are some alternatives to Ozempic? So alternatives would be the Unicity company makes a product called Unimate, which is a powerful cholinergic acid-based product. They're balanced product. And then we have Cali. So these are other powerful appetite suppressant supplements. Oh, nice, Lewis or Luis. Um, Creeper QT. Monjaro for a year lost 145 pounds. That's great. That's awesome. Good for you. That's a lot of weight to lose. And I know that's not easy. So, in a nutshell, the secret to being able to maintain that weight loss for the rest of your life is going to be dependent upon you, the choices that you're making now, right? So, implementing the strategy around fasting, lowering your carbs, reducing the consumption of processed foods, resistance training, supplements, keto, stress management. Yeah, Luis, peptides are amazing. My favorite combo, I would say, if you're looking to really optimize your physique, would be testosterone therapy and some light growth hormone peptides with a lot of fasting, a lot of weightlifting. That's like the best for your health, that's the best for your wallet, and that's the best for your physique, hands down. Yes, there's like 100 times more cholinergic acid inside of the Unimate product than there is regular yerba mate tea. And the cholinergic acid gives it a lot of the potent effect. It gives it that adaptogenic energy boost, that focus, and that appetite suppression. I still do Tirzepatide. Only question. Oh, there we go. If I'm eating healthy and doing exercise every day, I do Tirzepatide. Why wouldn't you be able to do Tirzepatide? Um, yeah, Creeper, we can definitely help you. We work with a lot of autoimmune patients, so we definitely have the structure and the capacity and the knowledge to be able to work with you. Let's see. Well, Luis, it would depend on what your current testosterone levels are. Um, the enclophamine, I think you said you were in your 20s, right? So I get the concept of enclophamine, but I don't know what your total testosterone. Lisa, people don't talk about Trulicity as much because it's not nearly as powerful. It's not nearly as powerful as um, some of the glutathione at the time. Yeah, absolutely, Luis. You can always reach out to us. I can get you on a consult with one of my experts, and we can go from there. Oh, Brenda, no, no, no. What got into my mind is the numbers dropping. I'm trying to figure that out. That's so funny. No, it was a good night. I'm probably gonna call tonight. I've been on for about 2 hours tonight after working all day, but I'll definitely be back tomorrow. Um, Tomorrow, same time, guys. 6:30 is a good time. I'll be on tomorrow. Actually, what time is tomorrow? Let me see. Tomorrow, I have a podcast. So I'll be on tomorrow on 7. Tomorrow, I'm fasting, so I don't eat dinner. So I go from coaching to podcast to live tomorrow evening. So that'll be good. Yeah, we did really good. It was really cool. A lot of fun. I'm definitely going to answer any more questions that you guys have. before we call it a night tonight, guys? What other questions do you have? See thousands of people watching people sleep on live. I've seen some interesting things on lives. Oh, you're welcome, Luis. I appreciate that. Joe, I'm gonna have to try that. No, I haven't. It's hard. It's hard. It's hard to do the Zoom for the live. Getting people to them. You know what I mean? Yeah. No, Luis. I hear you, man. You definitely want to keep it on the safe side. Yeah. So, Dip, I'm thinking your question is just you're wondering about Tirzepatide as an option. The best way, guys. Before I end it tonight, you guys see in front of my face, weanoffmeds.com. So go to weanoffmeds.com if you have any questions about last class. Fill out the form, get your questions answered, schedule a consultation, and if this is the right choice for you, I'm excited. We'll work with you and we'll get you going. Red light therapy is powerful, Kathy. Um, it could be a good aid if you have the time to get to a place and wrap the red light around you 2, 3 times a week. So it's tough to do. It's not convenient, but if you do have access to it, it definitely helps in its own ways. Um, Thoughts on spacing 2 to 3 weeks to maintain weight and not lose any more on Monjaro? So, Angie, I can't give you specific medical advice, but the concept of decreasing your frequency as a stepping stone down, I think totally makes a lot of sense. And I think that could be one strategy as you continue to stabilize and transition off. I would still say the goal would be keep improving, keep improving, which means less often, less often, less often. But but absolutely, that's a good transition point. So, all right, you guys take care.